Our Home Together campaign spans from April to May and pays tribute to our donors, our clients, and the heartwarming stories that unite us through weekly live online events on our Facebook page. You can also catch a replay of our events, including this one today, on the Street Dog podcast. So today's event is part of a digital storytelling journey that celebrates the profound bond between pets and individuals experiencing homelessness. Our Home Together campaign empowers our clients to share their experiences of receiving free veterinary care from the Street Dog Coalition. And it also celebrates the impact of our donors and how their support helps both ends of the leash, keeping pets and their people happy and healthy. So, our Home Together campaign is going to culminate in our first ever big week of giving from May 25th to the 31st. And our goal is to raise $50,000 from our amazing supporters to continue our mission of providing free veterinary care to pets of people experiencing homelessness. So, if today's conversation really resonates with you and gets you amped up and fired up to support our work further, please go ahead and click the link in our show notes to donate or go to bit.ly/Home Together 2024. And please play a part in helping to protect the bond between pets and people experiencing homelessness. And our friends at Pretty Litter, a renowned health monitoring cat litter brand, we love you, Pretty Litter. They are going to be matching all donations up to $15K for this campaign. So if you donate today, you can double your impact thanks to Pretty Litter. And today's episode is going to be really exciting because it is in a way kind of our gift back to the incredible donors and supporters and volunteers who have given so much of their time, talent, and energy to our organization. So what we're going to be doing today is we're going to be talking a little bit about preventative veterinary care when it comes to helping your pets at home, when it comes to protecting pets of people experiencing homelessness. And it's going to be a really great time. We've called this event Curious Critters Q&A because I know that a lot of us have questions around how we can keep our pets happy and healthy. And fortunately, we have two professionals in the house here, Street Dog Coalition family members, who are going to guide us through a conversation that is going to be really eye-opening and exciting from a veterinary health perspective. So welcome to the podcast, Dr. Hilary Wheeler. Look at my cat standing up. Very excited. Dr. Hilary Wheeler, she is our Street Dog Coalition Medical Director and our Bay Area Co-Team Lead. And we also have Dr. Kathy Makolinski. She is the Board Chair and our Buffalo Co-Team Lead as well. So welcome to the podcast. So great to have you both here with us today.
Thanks.
Thank you for having us. Yeah, we're excited to be here.
I'm so grateful. And I think this episode has kind of, been a long time coming. We often in previous episodes have kind of demystified things revolving around pet health and preventative veterinary care. But this is going to be our opportunity to kind of really just dive in a bit deeper and chat about issues when it comes to pet health that I think a lot of individuals may have questions about. So let's dive right into these questions. Are you ladies ready?
I'm ready.
This
I
is
do want to also say the
Yeah.
fun part of this is Kathy and I, Dr. Makolinski and I, have differing backgrounds, which I think makes it really great to kind of chime in on our different perspectives. I come from more of a general practice, clinical practice background, and Kathy, I think, correct me if I'm wrong, more from a shelter medicine background.
Yes.
So, and then both of us obviously being co-team leads for our local Street Dog Coalition team. So I'm excited too to see the differing perspectives on some of these questions.
That's really fantastic. Thank you, Hilary, for shining a light on that. Yeah, I think we have so many supporters who work in veterinary care, And I know that they'll really appreciate that distinction, because while there are some similarities, those are two very different worlds with very different, needs and problems, and solutions. So thanks so much for that, Hilary.
Yeah.
Let's dive into one of the areas of interest when it comes to veterinary care that I think is really the Street Dog Coalition's area of expertise, if you will. It's what we do most, and I want to encourage our listeners to chime in if they have any questions or comments. Now is your opportunity to get some answers to questions when it comes to general veterinary care and preventative medicine. And I know that Kathy and Hillary will probably echo this even more than me. But if you are having specific issues with your pets, whether they are dogs or cats, or if you think that your animal might need some kind of emergency care, we're going to encourage you to go ahead and seek out the support of a local veterinarian near you. Because, of course, right now, what we are talking about are big picture, big brush stroke preventative care issues, and we want to make sure that we are not diagnosing any issues here on this podcast episode. So, as I have a rogue cat hair in my eye, I don't know
Um,
what the medical treatment is for that, guys, but I'm not going to ask you to diagnose me. So, let's
the
let's
other
get
important point, just to
yeah.
highlight, is that hopefully with appropriate preventive care for our pets, we can avoid problems in the future
Yeah.
that make us have to take that pet to an animal hospital for treatment. So many of the things that we treat can be avoided with proper preventive health care.
Mm, thank you for that, Kathy. And maybe, Kathy, you can dive a bit deeper into that, because, of course, my first question is, what are some of the key preventative care practices that pet parents should prioritize for their furry companions, whether these individuals are currently housed or unhoused? I know there's a lot of similarities and overlap there.
Yeah, for sure. The Thankfully, we have guidelines that direct recommendations for vaccination. These guidelines are written and updated every couple of years that very nicely have recommendations for animals in the home environment as well as animals in shelters. So I'd say one of the biggest preventive care strategies that Street Dog engages in is providing dogs with a distemper parvo vaccine, cats with an FVRCP vaccine, and both species with a rabies vaccine. For dogs in particular, that vaccine is super important in preventing parvovirus. Parvo is a disease that affects dogs in their intestinal tract. They oftentimes will have vomiting and diarrhea. And a lot of times when the dog is not vaccinated and is showing signs of that contagious disease, it can be many days worth of treatment in a veterinary hospital in order to turn them around from that condition
Mm,
and to actually have them survive a bout
wow.
of the virus.
Yeah.
So that's one of the biggest vaccines that we offer. Obviously, rabies vaccine super important too, in that it prevents a communicable zoonotic disease. Rabies potentially can affect humans. So we want to make sure that we're giving our pets a vaccine to prevent not only them from contracting rabies, but from humans contracting that disease as well. And don't want to forget our cats. The FVRCP vaccine, super important, in that it prevents panleukopenia, which is a lot like parvovirus in dogs. And it also helps mitigate the negative side effects of what's commonly known as the kitty cold or a cat cold, upper respiratory tract infections. So really important that people engage in having their pets have the initial series of these vaccines and to keep them up to date according to guidelines.
Yeah. And what Kathy was so eloquently discussing, those are core vaccines, and you may hear that from your veterinarian of we recommend core vaccines, and what we do with Street Dog Coalition as well. Those are vaccines that regardless of lifestyle or background, every animal should receive. So a lot of people will say for cats, if, for example, my cat's indoor only, it's really not an issue, there's no exposure. We know that we can bring home fomites, which is kind of the microscopic means of transferring viruses, bacteria, particles to our animals. And so even if you have an indoor animal or an animal that's mostly in your contained yard area, we know that there are different ways that they can contract these diseases and have that risk. So a lot of those vaccines are for all of those animals for that reason, just to protect everyone from those basic illnesses. And then there are non-core vaccines, and those really depend on the lifestyle. If you have a cat that does go outside, we do have to think more about feline leukemia virus, which is transmissible from other cats, usually from bite wounds or direct prolonged exposure. So that may be something your veterinarian talks to you about, especially if you're not sure, if you have a new cat coming into your house and you're not yet sure if they'll have interaction with another cat. Other than the vaccine perspective, we also recommend parasite prevention. And that's, you think about the nasty, disgusting worms everyone hears about that can live in the intestinal tract of animals, and that's both dogs and cats. And I know it's a terrible thought, but pretty much every single puppy and kitten out there has intestinal parasites. And that's just the way it works in the world. And they're getting that either from the mama dog when they're in utero or just environmental exposure. So that again is part of preventative care, why we will recommend deworming at set intervals to help get every life cycle stage for that parasite and clear them of those infections. And we also oftentimes have you bring a stool sample, so a sample from the poop from your animal, and that's to test for other parasites that may not be necessarily treated with the routine deworming medications that we use. So then obviously we will prescribe something different to address those infections. So parasite prevention for sure. And the other big thing that's pretty much pervasive now across the United States is heartworm disease. And that's a blood parasite that's carried by mosquitoes. So again, even if your little floofy multi-poo is mostly indoor only, maybe never leaves your lap, we know mosquitoes find a way inside. And I always share with people, I'm in California. We previously, historically, didn't really think we had a huge issue with heartworm disease. We are seeing that more and more in our animals. And a lot of that does have to do with likely climate change. A lot of it has to do with animals coming in from other states and these diseases being transmissible to other animals. So we know mosquitoes find a way inside. And so that is something we want to make sure every dog is protected for. And that's really easy to prevent by just giving a monthly deworming medication that specifically targets heartworm disease. And a lot of them have the added benefit of also protecting against some of the more common intestinal parasites.
That's, you know what? One more reason to hate mosquitoes. Here we are thinking
I know.
we're safe in California. But it's so interesting to hear you say that even if your cat is an indoor cat, that we can personally trace in, things from the outside world that could increase the risk of cats getting sick. And I know sometimes individuals like myself, I have my cats and then I have my dog who goes inside and outside. And I always think it's important for the cats to be protected from certain illnesses that the dog might bring in from outside, that the dog has preventative care against, but that the cats might not. So I really appreciate you shining a light on that. And maybe we can kind of now chat for a second about so all of the issues, or rather all the preventative care that you just beautifully both kind of went through here. These are obviously preventative care treatments that apply to animals regardless of the housing status of their guardians. But I do know from all of the experience that you both have collectively on opposite sides of the country, which is so cool, by the way, that there may be certain health issues or health risks or preventative care needs that are specific to unhoused individuals. So maybe Kathy, maybe that's something you can kind of speak to in your experience from our street clinics. What are these common pet health issues faced by pets of unhoused individuals, and how do we as an organization address these issues?
Yeah, awesome question. If we think about the lifestyle of a dog or even a cat who lives with a person who is unhoused, they may be touring around the city a bit more than a pet who lives in a home and who has access to their backyard. So even more important for that animal to be protected with vaccines to prevent things like distemper, which is a viral illness, and panleukopenia and parvovirus, because they may be at greater risk of encountering those viruses in their environment. The other thing that we see a lot with animals who attend our clinics is something as simple as having external parasites, fleas. They sometimes an animal will have a flea or two and not be all that bothered by it. Sometimes an animal has an adverse reaction to the bite of the flea and has a flea allergy dermatitis, meaning the bite of that one or two fleas even causes a pretty severe reaction in their skin. Their skin becomes itchy. They start biting at it, scratching it. They get secondary bacterial infection in their skin. It's very uncomfortable for the animal. So when we see an animal who has that, we try to impress upon the owner the importance of having that animal have year-round, really high quality flea control, so that not only can we keep the fleas off of them, but we can prevent that secondary flea allergy dermatitis, which is pretty disturbing to the animal and pretty uncomfortable for them. So, and then another thing that I see, this isn't really preventative healthcare, but in animals who are in very hot environments, and walking around quite a bit outside, they may have paw pad problems, either irritation or actual burns to their paw pads. In the opposite environmental conditions, they can have salt or snow or ice accumulate in their paw pads and in the hair around their paw pads. So I've seen people have booties on their animals to both protect them against the heat and the snow that gets caught in there. So that may be something that Street Dog Coalition teams can advise folks on and try to even source those supplies for them so that they fit the dog appropriately and will prevent some of that secondary irritation that we can see.
And they look so cute.
Yes, they do.
Clearly, one of us on this panel is not a veterinarian, and it's me.
Hey, we think they look cute too.
They
We're
are so
all about the
cute.
cute.
And
And you
that,
know,
yeah, go ahead, Hilary.
I'm gonna have to give a huge shout out because we always do, but Merck Animal Health is a huge supporter of Street Dog Coalition, and it's thanks to them that we are able to give these core vaccines to the animals that we see at our street clinics, as well as Kathy mentioned, not just flea tick prevention, but like a really effective, high quality flea tick preventative. So we're so empowered in our ability to help these animals and protect a lot of diseases by vaccinating them, sending them with a supply of flea tick prevention and heartworm prevention, and knowing they can come back to our follow-up clinics and get refills as needed. So huge shout out to them for making that possible. And we even see occasionally, I know my team in the Bay Area, we saw last year, we had a lot of flooding. People probably heard about that on the news in California. We actually saw a disease called leptospirosis, which is zoonotic. So as Kathy had said, just like rabies, zoonotic means it can affect both people and animals. And it is a potentially fatal disease. It's carried by a bacteria, and that's in the urine of wildlife. So we think of, oh, I don't live where wildlife is. We all do. We're all in spaces now where people may see all sorts of different critters coming through their backyards or through the community, but even rats can carry it. And we know rats are pervasive and live everywhere. So we saw, because of the flooding, there was a lot of standing water in the area where there was a large homeless encampment. And dogs and cats, but mostly dogs, run pretty freely through those encampments, and they were getting exposure to this particular disease. And there were several people that were hospitalized as well. So what was amazing is that's a non-core vaccine, although there's a lot of debate now that it should be considered core because that disease is becoming so prevalent. But we were able to actually order leptospirosis vaccines from Merck. And we went out and did several special clinics, street dog clinics, purely to vaccinate all the dogs at that encampment with lepto. And we needed to do a booster a month later. So we got our volunteers together and we went out and did it again. And it really was amazing to see the community response, and just getting the awareness out there, but just the gratitude too, which we love at Street Dog Coalition. We all have so much gratitude, both for our sponsors, for one another, for our volunteers, but especially for our community partners. So that was one of those things that, again, you don't necessarily think of it as preventative, but it really is. And it's becoming something more and more we're having to address some of these diseases that crossover between people and animals, depending on the environment, depending on where you live. I mean, and even as Kathy was saying, we see a lot of these other conditions like skin irritations, we see ear infections, we can see ingrown toenails or mats. You know, mats can be really painful on an animal's skin. And obviously, it's hard when you are living on the streets and on the go. You're not going to have access to brushing and groomers and all of that. So, what I love too is we do give our teams clippers. That sounds so basic, right? That we have clippers. That's nobody thinks of that as something exciting, but it is amazing. A lot of our clinics, we've got a team set up at a table just doing basic grooming. We don't do it in a pretty way. So I always tell people we're not professionally trained groomers, but we are able to get rid of some of those mats that are causing discomfort. And then that allows the person to treat the skin with whatever medications we're prescribing. So that's something we see pretty commonly at our street clinics. And again, we're so fortunate that we're able to help.
Yeah.
That's so well, that's so well said. Go ahead, Kathy. What were you
I
going to
just
say?
wanted to mention one other thing that sometimes is not highlighted, but is super important for animals who are living with people who don't necessarily have a stable residence, is that they should have a picture, if you can, on a phone, or even a written printed document that shows that the animal has been vaccinated for rabies and is up to date on that. Also, depending on where you live, there's various licensing requirements, but we have seen situations where a person was separated from their beloved animal. That beloved animal was in a shelter operated by the municipality, and they had to produce a record of ownership in order to be reunited with that pet. So the record of ownership may include a copy of your rabies certificate, or a copy of a valid license that you have obtained for this animal. The other thing that you could, very important to keep track of, is having contact information up to date for a microchip, if we ever implanted a microchip in the pet, because that's another way to prove ownership and another way for you to be contacted if that animal does become separated from you. If the person does not have a phone, it might be a good idea to have a secondary contact be put in on those things for contact information, so that if your animal is ever separated, they could make a phone call and that person could alert you to where your animal is located so you can have a joyous reunification with them.
That's a great point. And honestly, that should be mentioned as part of preventative medicine, is both for people who bring their pets into their vet and for people who bring their pets to Street Dog Coalition clinics. We are able to provide and implant microchips, and we will help with registering those microchips. It is free. And the most important thing, though, is we have to make sure, as Kathy said, if your contact information changes, that gets updated and there is a primary contact or someone else that can help. And I'm going to just give a big shout out. I can't miss this opportunity. Just in the last couple of weeks, Kathy's team actually was contacted because there were 2 dogs that had been picked up by the shelter, and they had been separated from their person for different various circumstances. And we were able, between myself, Kathy, and Julie, our inventory coordinator, we were able to contact the shelter. Kathy sent over the rabies information. We contacted them with payment to basically pay their bond to get them released, and get them reunited with their person. And it was just an amazing sequence of events. And I think we did it within a matter of hours, and all through email in different parts of the country.
Of course you did, because of course you did in a matter.
Yeah, but this is what we can do, and that's what's so amazing about the passion that's there that fuels all of us to really want to help, and really having your eyes open to these situations that we don't think about and we take for granted, when we all love our pets and we can't imagine being separated from them. Imagine if your pet is your lifeline, which is the case for many of us, but especially if you are living in circumstances that are extremely challenging and dealing with all the consequences of housing insecurity and food insecurity, and your animal truly is what keeps you going and gives you purpose each day. That connection is so deep. We have to preserve that. And part of preserving that is keeping them healthy, providing preventative medicine, but also being able to ensure that these animals can be returned to their people if ever they're separated for any reason. So huge shout out to the Street Dog Coalition team, because that's what we're all about. And those are circumstances we actually see pretty frequently for various teams across the country, and try to make sure that we can expedite that process whenever possible.
That's so helpful. And I have to tell you, I know that our listeners are learning a lot. I'm learning a lot. Number one, I have my cat's annual veterinary checkup coming up in a couple of weeks. I always forget a stool sample and have to drive it back the next week. I'm going to remember it this time. I'm making a note.
Yes.
And also my cat, who was adopted during COVID from an animal rescue, I'm pretty sure that her microchip is still connected to her like initial foster. So here I am admitting my own oversight here. And I'm only admitting it because I think that so often, whether you're housed or unhoused, you have the best of intentions for your animals. But some of these things we just forget. Some of these things we just overlook because life is busy, and sometimes we're so distracted taking adorable pictures of our cats that we forget to update their microchip information. So I'm having a come to Jesus moment right now, and I will be doing that the moment that I hop off of this podcast recording. And so I can only imagine how this conversation is helping members of our audience, if not shining a light on things they didn't know, maybe reminding them of things that they should have done 4 years ago. Guilty. So before I let you both go, I want to just ask you one question, if and then I will let you both go. And I need to really, what I also want to have a conversation about at some point in the future, a different episode, is like pet nutrition. I don't think we've really done a deep dive into that, and I have a lot of questions myself. So for those of you who have questions about pet nutrition, please keep an eye and an ear out for an upcoming episode about that. But so my last question for you both is let's start with Hilary. Hilary, If you could, I love this question. I ask it sometimes. If you had a billboard and if you could put one message on that billboard that would help protect pets, what would that message be?
Yeah, I mean, honestly, to tie it all back to preventative care, it's bringing your pet in to see the veterinarian. I honestly recommend every 6 months, even when they're young. When they're young, we actually see them more often because we're doing booster vaccines for those core vaccines and doing dewormings. But prevention is so critical to not only keeping them healthy, but we know so many of these diseases really are preventable, and we can avoid expensive emergency visits if they come in for their routine checkups. And sometimes people think they're not due for a vaccine, they're not due for anything, they're fine, they seem healthy to me. And so they don't really see the value of those regular wellness exams. And one thing we know as veterinarians is animals are incredibly amazing in their ability to hide early signs of disease.
Yeah.
And that's our whole purpose. When we have them come in, we're doing that full health exam. We're looking at their teeth, we're listening to their heart. We are looking for any changes in their health that might indicate the early stages of a disease. And if we catch disease early, we can do so much more at an early interventional level that will help keep them healthy long term and hopefully improve their ability to stay with you and be healthy and live a longer life. So just wellness, preventative care. And we know it's hard for people that are unhoused to be able to do that, but that's what's amazing about Street Dog Coalition teams. We usually are requiring a minimum of 4 clinics per year for each of our teams. So there is going to be some continuity of care. There's always going to be that option to go back and see them every 6 months, every couple of months, whatever it ends up feeling right to you, depending on what you're seeing at home.
I love that. I love that. We got to get one of those billboards up immediately.
It's going to have to be a big
Bring
one.
Fido in.
Mhm.
Support your local veterinary office. I love
Right.
it.
That's
How about
right.
you? How about you, Kathy?
Yeah, I actually, when I'm driving around, I see billboards and think of this.
I'm
What,
sure
what,
you do. Could
what would
save
I
you a
put
lot of
on?
heartache.
Oh, exactly. And it's kind of an old message, but still very true of spaying and neutering as a preventive care
Yes.
strategy. We see a lot of problems that could have been prevented by early spay and neutering, meaning for cats, within the first 5 months. So at about 5 months of age, your male or female cat should already be spayed or neutered.
Yep.
Dogs, different recommendations coming out about timing of that. But the preventive aspect of it is if you get to male cats before they start developing the habit of spraying urine, of some behavioral conditions that go along with being intact, you may prevent surrendering that animal to a shelter for those issues.
Yeah, like behavioral issues. Well, what
Yeah,
we perceive to be as
yes,
behavioral issues.
exactly. It's
Cats
not a
being
behavior
cats, as I
issue for the
call it.
cat.
Right.
It's a behavior issue that we have trouble
E-
living with a cat who
Exactly.
develops those behaviors.
Yeah. That is
Um,
such great advice.
yes. So that and prevention of pyometra in females.
Mm,
So often our spay neuter clinics are tasked with dealing with emergency situations, trying to save this female cat or dog. When having that cat spayed when it was healthy, or the dog spayed when it was healthy, would have been a much easier and less costly procedure for the owner.
mm. That's such good advice. Now my head is spinning with future podcast ideas. Like really what I want to, and then I'm gonna let everyone go because I'll just keep talking. I would love to have a conversation. I'm thinking which one of our volunteer vets would be best to bring on. But I know that there is this There is, depending on your background, your culture, your experience with animals, there is a lot of hesitation around spaying and neutering pets. Um, I lived for a very long time in, Washington Heights, New York City, very Dominican neighborhood, the best time of my life. And that community in particular, with their beautiful pit bulls and their, glorious cats, I noticed more so than other communities I had lived in, there was a lot of hesitation and resistance to spaying and neutering animals. And I know that it has to do with culture. I know it even goes back to, lacking trust with medical professionals, which of course we can't blame marginalized communities for lacking that trust with, medical professionals. I digress. Anyway, I'm so glad that you brought that up because I know it is one of the both simplest and sometimes most complicated culturally things that we can ask our patients to do is to spay and neuter their animals. And I'm really grateful that the Street Dog Coalition provides vouchers, partners with, local veterinary companies and organizations to help ensure, and also in addition to that, educates the individuals who come to our street clinics about why it's important, and about, how, we understand you want your dog to have just one litter, but here are all the reasons why that's not the best idea. What is
Yeah.
that just one litter thing? Okay. But you know what? I'm not not gonna go there. I'm sorry.
That's another podcast for sure.
And I'm of course laughing more at myself and not at the individuals who have that idea, who always mean well. It's always the most well-intentioned individuals that have that idea. But yeah, we'll have to reconvene and we'll have to shine a light on the cultural implications and history of why individuals lean toward that decision and maybe
Yeah.
demystify some stuff around that. In the meantime, I want to thank you so much, Kathy and Hilary, for coming on this podcast today, for engaging with our individuals who are here tuning in live. I see we have a dozen people who have been hopefully taking notes and hopefully checking little things off of their reminder list as I'm doing right now. And I want to thank you both so much for all that you do for our organization, all that you do for pets of people experiencing homelessness. And I know, Hillary, you are also, you have your own practice. And I know, Kathy, you are only doing 10 million things at once as well when it comes to providing veterinary care for pets. So I want to thank you both for taking the time to chat with me today, and I want to thank our audience for tuning in today. I know in the past we've had lots of conversations around pet health, but this I feel like was a real great refresher for some people and a really awesome cornerstone conversation for us to build on in the future. So thank you both for chatting with me today and for laughing and for answering our questions. And I want to thank our community of supporters for taking the time to tune in. And again, if this conversation resonated with you, if you see the value in protecting the bond between pets of people experiencing homelessness, as much as we see the value in protecting that bond, please go ahead and click on the donation link in our show notes. And again, Pretty Litter is going to match your donation so it has twice the impact. And every donation that you make is going to go directly toward helping pets of people experiencing homelessness get the veterinary care that they deserve and that they may otherwise not receive from coast to coast. So thank you again both for tuning in today, and thank you to our audience. Until next time, ladies.
Thank you very
Thank you.
much.
So
Thank
good
you.
to hear. Bye.
Bye.